Injury and Illness Management Program. 2. Content. Applicable regulations and procedures. General explanation of bloodborne diseases. Exposure pathways to infectious viruses. Tasks that might cause exposure. Control methods and limitations. Proper use and location of personal protective equipment, PPE. Medical and post-exposure procedures. Signage and labeling. Disposal procedures for contaminated products, equipment, or materials. 4. Applicable regulations and procedures. Introduction. 5. Where bloodborne pathogens. Pathogenic microorganisms present in human blood that can lead to diseases. Examples of primary concern. Hepatitis B, HBV. Hepatitis C, HCV. Human immunodeficiency virus, HIV. Injury and illness impacted in the workplace. 6. Work illness. The virus threatens the body through injury and subsequently leads to illness. 7. Exposure pathways to infectious viruses. Contamination sources. Blood. Other potentially infectious materials, OPIM. Human body fluids. Any unfixed tissue or organ from a human. Cultures, culture mediums, or other solutions. Experimental animal blood, tissues, or organs infected with HIV or HPV. 8. How exposure occurs. Needle sticks. Cuts from other contaminated sharps. Contact of mucous membranes or broken skin with contaminated blood or OPIM. 9. Spread of bloodborne pathogens occurs through direct contact, indirect contact, respiratory transmission, vector-borne transmission. 10. Occupational exposures. Occupations at risk include first responders, housekeeping personnel in some industries, nurses and other healthcare personnel. CDC estimates that 5.6 million workers in healthcare and related occupations are at risk of occupational exposure to blood or OPIM, placing all such workers at risk. 11. Tasks that might cause exposure. Cooks, sewing department, cutting department, maintenance, carton department, clinic. 12. Control methods and limitations. Establish an exposure control plan, written plan, PDCA. Management review and update of the plan. 13. Required elements of the exposure control plan include exposure determination, schedule and method of implementation in the workplace, procedure for evaluation of exposure incidents. 14. Additional plan requirements. Accessible to employees. Review and update annually. Conduct a risk assessment, ARA, when new or modified tasks/procedures are implemented. 15. Standard precautions. Treat all blood and bodily fluids as if they are contaminated. Proper cleanup and decontamination. 16. Engineering and work practice controls. Safe for medical devices. Sharps disposal containers. Hand hygiene. 17. Training. Target audience. All employees with occupational exposure to blood or OPIM, other potentially infectious materials, including those trained in first aid and CPR, cardiopulmonary resuscitation. No cost for training, provided during working hours. Timing. Initial assignment annually or when new/modified tasks are introduced. 18. Hepatitis B vaccination, offered to all potentially exposed employees. A declination form is provided. Note, no vaccinations available for hepatitis C or HIV. 19. Proper use and location of PPE. PPE examples: gloves, masks, aprons, smocks, gowns, face shields, mouthpieces, safety glasses, CPR pocket masks. 20. Employer's responsibilities. Perform hazard assessment. Identify and provide appropriate PPE at no cost to employees. Train employees on use and care of PPE. Maintain and replace PPE as needed. Review, update, and evaluate the PPE program. 21. PPE selection. Safe design and construction. Proper fit and comfort. Include required PPE training when it is necessary. What kinds are necessary? Proper donning, adjusting, wearing, and doffing. Limitations in the workplace. Proper care, maintenance, useful life, and disposal. 22. Employee responsibilities. Properly wear PPE. Attend training. Care for, clean, and maintain PPE. Notify management when repairs or replacements are needed. 23. Medical and post-exposure procedures. Housekeeping. Follow a written schedule for cleaning and decontamination. Pick up broken glass using mechanical means only, not by hand. 24. Cleanup and decontamination. Wear protective gloves. Use appropriate disinfectants. Clean and disinfect contaminated equipment and work surfaces. Thoroughly wash exposed areas immediately after exposure. Dispose of contaminated PPE, towels, rags, etc. properly. 25. Definition of an exposure incident. Specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood, or OPIM that results from an employee's duties. 26. Immediate actions following exposure. Wash the exposed area with soap. Flush splashes to nose, mouth, or skin with water. Irrigate eyes with water and saline. 27. Laundry procedures. Contaminated laundry must be bagged or containerized at the location where it was used. 28. Reporting exposure. Report exposure immediately. Direct employees to healthcare professionals for treatment. 29. Confidential medical evaluation and follow-up. Document routes of exposure and circumstances. Identify the source individual. Collect/test blood for HBV and HIV serological status. Administer post-exposure prophylaxis when medically indicated. Provide counseling by an expert and additional evaluation. 30. Signage and labels. Design posters and post them in identified hazardous areas based on the company's risk assessment. 31. Dispose of procedures for contaminated products, equipment, or materials. Regulated waste disposal. Dispose of regulated waste in closable, leak-proof red or biohazard label bags or containers. Dispose of contaminated sharps in closable, puncture-resistant, leak-proof containers.